Hello and welcome to the second Harvard Pilgrim Innovation Showcase. I'm Rick Weisblatt, the Chief Innovation and Strategy Officer here at Harvard Pilgrim. And I'm delighted to have a panel here of innovators and innovation supporters that are going to talk to us all about innovation here in Massachusetts. I'm going to start with just a brief introduction of each of them, and then you'll be hearing a lot more from them about the role that they're playing here in Massachusetts in the startup community. So to my right, Nick Doherty, welcome Nick, and then C.V. Bowden to his right, Aidan Fang, and Eric Gasfriend. So welcome all of you to the panel. It's great to have you here.
Thanks for having us.
Thanks. Thank you.
What I'd like to start with is talk a bit about what Harvard Pilgrim is doing with respect to innovation. It's always been an important part of who we are. We started in 1969 as one of the first HMOs in the country, prepaid physician group practice, and innovation has been in our bloodstream ever since. More recently, in the last 2 years, we've worked with Pulse at MassChallenge, which Nick will talk a lot more about, which is what's called an accelerator or incubator of startups. They work a lot with young companies, try to help them grow, find customers, and scale up. We've been a founding member of Pulse, and we've worked with a number of the Pulse companies over the last couple of years that I'll talk about a little bit more in a moment. Harvard Pilgrim's also been on the Governor's Digital Health Council. Governor Baker has made making digital health an important part of the Massachusetts economic ecosystem as part of his administration. He formed this council to find ways to help support the startup community, draw them to Boston, help them find financing, scale up, and of course hire people as part of an economic engine here in Massachusetts. Very exciting endeavor led by the governor. For Harvard Pilgrim, we've collaborated with other members of the Massachusetts innovation community, including such stalwarts as Boston Children's Hospital that we're working with and hope to launch something with this September. For Harvard Pilgrim's participation in Pulse, last year we piloted 3 companies. The first was a company called Gain Life. This is a company that's got deep knowledge on behavior change. They were working with folks around weight loss. It was a tremendous success here. We actually piloted it with our own employees. We like to eat in our own kitchen, as it's said, to help the startup community. And then we brought them out to the city of Boston, which is one of our largest accounts. Cake was a second company, and they're trying to develop and have developed a terrific approach to end-of-life planning. Not when you're at your end of life, but actually when you're much younger and you can start to think about how you would like those last few months to go, including even what music you would like played at your memorial event. A third company was 3Derm, a terrific company in a clinical space where they've put very high-definition cameras in primary care offices to take pictures of any skin issues that a patient may have. Those films go to a dermatologist at the local teaching hospital for review, and the patient can find out everything is fine or they should be seen fairly quickly. A terrific outcome in a specialty where access can be an issue. So that's just a couple of the companies that we worked with last year. This year, there are 2 additional Pulse companies that we're working with and are really excited about. One is called Aluna, and they've developed some innovative techniques for helping patients with respiratory illnesses and diseases, including asthma. Gamification of taking care of yourself, learning how you're doing, and then correcting any issues you might be having before they become serious. Terrific new innovation in that space. A second company, and they're here today, represented by Eric and actually his father also over in the showcase, who's holding down the fort there, is a great new company around addictions treatment that's also looking at web-enabled approaches, scientifically sound ways of helping people with that. Obviously in the midst of an opioid crisis and the never-ending alcohol abuse issues in the country. We'll hear more from Aidan in a few moments. Another area that we're working on with Harvard Pilgrim staff is called crowdsourcing. We implemented this last year, and what it is, it's a way to put a challenge out to all Harvard Pilgrim employees and they get to comment, create new ideas, build on each other's, to give feedback to what we could be doing in particular areas. The first one we did was in health insurance literacy. We hear at Harvard Pilgrim a lot from our customers that it's hard for them to understand their products. Either they're too complicated, or even if they're not, it's just not something that people understand. And then when they need to use it, they're not quite sure what their benefits are and so on. So we crowdsourced that, had over 200 ideas that came through from our own staff that we built on and are now implementing in how we communicate to members, how we build those products, how we help them understand those products when they need to. A second one was what we called Go Green. Harvard Pilgrim, like a lot of companies, would like to reduce our carbon footprint here in Massachusetts. So a group of folks did crowdsourcing there. And some of it is small enough, like a poster we have in this room where we're sitting, to don't forget to turn off the AV system and the lights when you leave. We have a lot of lights on today for this event, but usually we're trying to reduce the electricity and other things that use up carbon. A third one that we've done is around millennials. And so we put a challenge out to our staff. What could attract millennials to Harvard Pilgrim, and what are the products and services they're looking for that maybe other generations might not be thinking about? Because many millennials want care when they want it. They want to be able to access information on their phone. And so they approach healthcare very differently. But they're also really interested in health and well-being. And so we've looked at services and products that would promote that as well. So at Harvard Pilgrim, we think innovation is really part of our future. It's always been who we were, but we want to be even more in that innovation space in the future. So enough about us. I want us to hear now a bit from our panel, and I want to start with Nick, who's the director of Pulse at MassChallenge.
Cool.
Nick?
So it's awesome to be here, Rick, and it's also really cool to hang out with a bunch of our entrepreneurs as well. And Harvard Pilgrim's been an amazing partner with our startups. And I mean, how our program works is we match startup companies with large organizations to address the massive challenges in healthcare. And health more broadly. So we see that healthcare is moving outside of the home, and Aidan will talk a little bit about that too. And also CV, with his story, I don't want to steal too much of the thunder, but it's really cool to see these amazing evidence-based programs transitioning out of the academic medical centers and into people's lives, into their homes. And so we work with Harvard Pilgrim, but we also work with over 30 partner organizations, payers, providers, pharmaceutical companies, device companies, patient advocacy groups. I mean, really, it runs the gamut. We have Harvard Pilgrim, Cigna, Aetna, Mass General Hospital, Brigham and Women's, Boston Children's, OSF, that's based in the Midwest. So it's not just Massachusetts, the people that are participating, and we can go on forever with like Vertex and Shire and all of that. So
just don't mention other insurance partners.
Okay. So just Harvard Pilgrim is the. But I was going to say that what's been really unique about the Harvard Pilgrim relationship is the speed at which Harvard Pilgrim has been able to work with and integrate with these companies. So while a lot of our partners, they may take the whole program to do something, or they maybe will launch with their companies a couple months after the program ends. Last year, Harvard Pilgrim, in your work with Cake and Gain Life, we were live with the city of Boston in like really early May, and you were live with your employees even before that. And it was pretty tremendous. I mean, we had our first meeting with the city of Boston, I think it was on March 31st. And we were live with the city of Boston, I think, in 31 days. Got through the union, got through all that stuff. So it speaks to Harvard Pilgrim's team and the vision and what you want to do. And it's exciting for me in my role where, I was an entrepreneur. I had a startup. We were fortunate to successfully exit, but there's a lot of pain that goes with that process. And you have a solution that is going to impact people's lives in a really meaningful and positive way, and you're hitting these roadblocks, and everybody talks about how slow healthcare can be, and I feel that frustration. And so when we went to design the Pulse program, We wanted to design something where every entrepreneur was matched with a partner organization, and every one of those relationships was focused on addressing a real challenge in healthcare. And by the end of the program, they were going to get something done. And the big philosophical question before we launched our first year was, would this even happen? Is this even possible? And we were blown away by the results. Where last year's program we had over 80 partnerships generated. The companies earned millions in revenue, millions in funding. They increased their employee size, in a pretty tremendous way. And so when we talk about the Digital Health Initiative in Massachusetts and why it was created as this sort of economic driver, can we create the next biotech cluster but have it be digital health? Could we do that? And so far the answer has been yes. We've been able to do it. And now in our second year, we've generated over 100 partnerships. I know that the startups have raised millions of dollars and they've earned millions of dollars. So it's really exciting to see that we're replicating the results again. And the most important thing to me is that yes, we're creating this big economic development initiative around digital health, and it's great for the Commonwealth of Massachusetts. But more excitingly is when these companies are successful, their goals are to help people live healthier and happier lives. And so we're definitely going to reap the health benefits, and we already are. So it's exciting. You'll get to hear more about what these companies are doing. But I have one of the best jobs, and it's fun to work with really cool people. So thanks for having us.
Sure, and I have to give a shout out to you and your team, because what you guys have put together in the last 2 years is unbelievable.
Thank you.
So thank you for your leadership and to your team.
We have a really good team. Yeah,
and I'm assuming they're watching because you probably told them to. So I made sure I got that in.
Yeah. They'll be replacing me next year on this panel. They're way better than I am.
But seriously, from a standing start, you guys have done a great job.
It's been fun.
And we're better off for it.
Thank you.
So next I'll turn to Sivi and Healthination.
Sure.
Tell us a little bit about yourself, Sivi, and about the company you've started.
Yeah, I mean, I've been lucky enough to be with Nick since cohort 1. So we're a return company, and wow, what a difference a year brings for us. We're doing all sorts of wonderful things this year. It's unbelievable. What's fun to talk about, I think, is the journey that you take to get to weird places.
Yeah.
To say the least. I started as a banker, which is weird in itself. And I was there for like a good 18 years. I never thought I was going to be a banker. I was a math major and an ec major, but I never thought I was going to be a banker. But I got there and I needed a job. And then I somehow liked it, and I somehow did okay with it. And then I left, and I put left a lot of money on the table, because it's a pretty good industry to be in. And said, I want to do something completely opposite. And so I went to join a video game company here in Westwood, Mass. And we were building out Lord of the Rings Online and Dungeons and Dragons Online, pretty geeky stuff. And somehow that company got bought by Warner Brothers. And I became the Warner Brothers whisperer, if you were. A bunch of engineers and I were building out a digital platform for all the Warner Brothers games, Legos and Batman and Lord of the Rings and Mortal Kombat, It was like all these different things. And we learned a lot about how to build digital platforms and how to engage with people. I mean, your video games have to engage with people.
Right.
That's mission number one. And what happened was I got pretty sick. I got very diabetic. I put on a lot of weight. Was treating myself kind of badly, flying all over the world and doing digital stuff for Warner Brothers. And I gained so much weight that my A1C was out of control, and I started to go to the Joslin Center here in Boston. And didn't know much about them, but I was told from a friend, you should go there. That would be a good place for you to talk to them. And I got assigned this wonderful doctor, who I became friends with since 2005. And eventually he got me into a program called the Why Wait program, and I think the video will be talking about that, so I'm not going to talk about that program so much, but it basically transformed me into a non-diabetic, or at least one in remission. And the thought was, wow, this exists? How come everybody doesn't get this? And the answer was, well, it's only offered out of one place, it's kind of expensive, all these things. And so that was a mission that we kind of set ourselves on. We said, can we get this to scale? Can we use what we've learned in Hollywood to engage with these people in a way that they're not going to expect, right? So it's really the unexpected. So that's when I quit that job too, and ceremoniously went into healthcare. And it's been a wild ride ever since. And that was only a couple of years ago. And luckily, I've been in Pulse, and I've been working with. This year it's OSF and Partners, Connected Health. Last year it was Boston Children's and Becton Dickinson, and all those relationships still exist today, and they're really wonderful stuff. So.
That's a terrific story, and I think will hear that each of us has a personal connection to healthcare that got us all in here. And I have to ask, do you dress differently as an entrepreneur than you did as a banker?
Yeah.
Yeah.
I was can I use the word black sheep of the banking world? 35,000 people. But by the end of when I left State Street, I was actually meeting with the CEO once a month, which was crazy. Because I was still, my hair was dyed red and orange, and I had this bad copper look that was terrible. And I would take out some of my earrings, I think back when I was a banker. But then in the video game world, I was the suit. Not that I ever wore ties or but like people didn't wear pants, in the video game world. So that's actually true, and I don't want to talk about it because it's very traumatic. But certainly people didn't wear shoes. They didn't turn the lights on. You never knew what was running around on the floor. It's pretty disgusting stuff, actually. But that all turned around when we got bought by Warner Brothers.
Right.
So,
and now you're an entrepreneur.
And now I get a lot of commentary about wearing black predominantly, which is just all my wardrobe is black. Sorry,
Right.
it just kind of is. And I do wear a tie, maybe twice a year.
Once a year at Pulse Finale.
Yeah, maybe a Pulse Finale. I like the non-tie look, but with black coat, black shirt.
Very good.
Yeah, that's.
Well, I think you've got a great company, and let's show that video and
Yeah.
let the audience see what you're about.
Cool. Yeah, please check out the video. Hi, welcome to the world of Healthination. I'm going to start talking about HI, which is a fun little thing to say, but for us, HI is our logo as well as it means health for the individual. Because all of our solutions start with thinking about the individual and how to engage with them, with their family, with their devices, when they're healthy in their worlds, when they need care, making sure we're making that experience the best it possibly can be, because we have to engage people where they live. That's incredibly important. We come from Hollywood. We come from video game space. And in those spaces, you can use the creative minds to create animations that create peaceful, delightful relaxation, make people feel young, make them laugh, make them feel safe. And this is the kind of stuff that we want to apply to our health solutions, because we created this platform where we're going to teach people to self-manage themselves through live coaching, through behavioral insights, rewards, integrations, and analytics. We're starting in the adult diabetes, obesity space, but ultimately we're going to do multiple types of products. And the way we do it is with our creative studio and all these engagement techniques that make Hollywood meet evidence-based medicine, which is pretty unique. So what we're trying to do is improve lives. Where we're starting is with obesity, pre-diabetes, and type 2 diabetes, both in the prevention space if you don't have diabetes, and the intervention space if you do. And we're going to do it in really the most amazing way possible, using all the power of our platform for engagement. The whole thing started when I was diabetic. I still am, but I've been in remission for a bit because of the Y-Weight program, which in 12 weeks allowed me to lose nearly 22 pounds. And my A1C, has remained low under diabetic levels. And in talking to my doctor about it, we realized that wouldn't it be great if we could unleash this program on the rest of the world through our digital platform? So we talked to the Joslin Center, who's been running this program for 15 years, with consistent results of 10% weight loss over 12 weeks, plus maintaining that after 5 years, 6.4% weight loss, which is enough for the American Diabetes Association to say, wow, this is an amazing program, and they gave it their Michaela Monin Memorial Award, which is very prestigious in the diabetes space. So we have the digital license for this program, and this is what we're bringing to folks, because we know that a diabetic's life and someone who's trying to lose weight is really crazy. So many decisions made in a given day. It really just sort of tells us that the healthcare that we have to give them has to be wherever they are in their pocket. We also know that about the psychology of trying to lose weight and trying to manage yourself, and there's a lot of barriers to that. What we need to do is get you to day 66 so that your body and your mind adopts the new habits, and that these solutions will stick with you for life. And that's really what we're aiming for with our coaches and with all of our engagement techniques. So we take the power of the creative studio, we use motion capture, we use facial capture, we use really Pixar level AAA animation to bring a very interesting solution to the weight space. So what we've done is we've created Lena. You're going to see her in a little bit. She's a 3D avatar. She's wonderful. She's your coach. She reacts to what you do. She's funny. She's silly. She's great. She brings you on a path every day, teaching you how the program works. She exercises with you, which we did via motion capture. There's a television show within the app. There's a live coach, really, getting you engaged, keeping you there, answering your questions. And it's very, very effective. So what you wind up having is you have Lena in your pocket teaching you this wonderful Y-Weight program every day. And if you listen to what she does and if you do what she says, you're getting your healthcare wherever you are, which is incredibly powerful.
The other thing that we do is we like to do integration with tons of different devices, whether it's blood glucose meters or weight scales or smartwatches, such that we can bring bio data plus the data that we're getting from the app together and even present it to your doctor if we'd like, so that your doctor can have a meaningful conversation with your patient in 60 seconds about how well you're doing on the program. And that's really meaningful stuff. What we've seen is amazing results. We see 82% retention in the current cohorts that we're bringing people through. People are touching the app 17 times a day, losing well over 5% of their weight loss in week 9 out of 12. And a lot of people are actually have already lost over 10 pounds. And you can kind of see some of the people that are very happy with loving their app, whether it's a doctor loving the app or the patient's loving the app. There's a whole bunch of stuff that we're going to do with it. So let's get right into the demo so you can see exactly how it works. Okay, welcome to the Healthination demo of Why Wait. This is the app as it exists today live. The first thing that you do is you actually meet Lena. Lena's our 3D avatar, coach, comedy relief, companion, rewarder, all the fun things about our app and the way that we approach getting you healthy. So create your account, get set up, onboard yourself with Lena. In this case, we have to set some goals, pick our foods, do all the things we need to do. She'll teach you about information security. Ultimately, you'll get to paths every day where you have certain tasks that you need to do. Here's a typical day, day 1. I can go into a food and say, yep, I did it, I ate it. When I said that I did it, Lena will be happy with you. If I didn't do it, she may be less so. And then I will get some rewards. In this case, I get to try to blow up the gopher on my golf course and collect points. Those points ultimately lead to a reward system. And those rewards can lead to virtual rewards like trophies. And those trophies can be traded in for titles, but we can also share these rewards with companies and for real physical rewards for the person. When it's days when you need to exercise, you look at your exercise routine. In this case, it's a very complicated circuit training routine. When you're doing your exercises, Lena will actually do those exercises with you in real time, showing you the proper form and the proper amount of time to spend on them. You can say I did it there. On tips, many of these tips are actually videos, and those videos are really fun because Lena will be the host of Healthination TV, and she'll usually do something very silly at the beginning of it. In this case, I think she's going to fall over. Yep, there she goes. And she's going to say something really funny that you can't hear to lay up the video where our Shakespearean actor Niall will be interviewing, in this case, Jackie Sherrar, who's an exercise physiologist, to talk about safety in exercising. When you need to talk to a coach, you have a real live coach doing one-on-one chat with you. You're also part of a community where you can chat with other people in your group, all of which provide higher engagement. Ultimately, we'll take you to outer space to collect your coins and many other places as well. That's the end of the demo. Hope you liked it. Thanks.
There you go.
Well, why wait indeed? What a great video. That was terrific. I'll remember that day 66.
Right, it is. Day
Right.
66, that's actually what happened with me. You could ask my wife how much of a pain in the butt I was on the program, eating right, trying to exercise when I didn't want to.
Right.
I resisted it. Day 66, it was like, why would I never? This is my life now. People are like, are you excited to be at the end of the program? I'm like, what are you talking about?
That's
This
terrific.
is what I do now.
Yeah.
2 years later, I still do it.
I'm going to apply that to the shanking that I have in my golf game. See if in 66 days I can.
Give it a shot.
And I hope people caught the Gopher Caddyshack reference.
Yeah, we
to
have
the,
we're not sure if they're Easter eggs or if they're just blatant loves of ours.
Right.
So we just did an Indiana Jones path kind of homage. We don't have the rolling ball, but it is one of those rickety kind of bridge things. And we're constantly, our team, we have a stand-up comedian on staff that she's actually been on Conan O'Brien, and she's out in LA, and she actually writes a lot of Lena stuff. And we're getting into just, we want people back in the app. I don't know if you caught that. 17 times a day, people are going into our app. That's absurd.
That's terrific.
I mean, and the fact that 82% of the people that you start with are still doing it, and then you get all the weight loss, right? You get 270 pounds across those people, and that's all amazing. What we're starting to get into now is even more engagement techniques. Things like we're actually going to craft a mystery, where Lena's going to be like Bogey, and it's going to be film noir, and it's going to be very silly. Right. But we're going to actually have a mystery for her to solve. And what you're going to do is every day tell her where to go next, and then you got to come back the next day to see what she did. And it's sort of like a choose your own adventure novel. And we just think, So much can be done in the engagement space that just isn't today.
Right.
I'm so sick of seeing apps that honestly, they're just too boring for me. And I know that I'm going to drop them after a month. Even if it's working for me, I'll still drop it after 90 days. We got to lick that problem.
Well, I'm sure we'll hear more about that because, you know, at Harvard Pilgrim, we think a lot about how to engage patients. I'm sure we're going to hear that from Aiden and Eric. There's a lot of research. We know what works, but getting patients, members through that and getting them engaged, that's one of the challenges, and certainly an interesting engagement tool for you, Aiden. So why don't you tell us more about Pillow?
Happy to. Thanks for having us here, Rick. And you know, I'm one of the co-founders of Pillow Health, and this is Pillow.
Hi, Pillow.
Yeah. Pillow is sleeping right now, but you'll see him wake up or her wake up on the video shortly. Essentially, we started the company in 2015 because of this lack of healthcare or lack of visibility from the healthcare system into the home. One of my co-founders, his father struggled with a chronic illness, and there was a great burden on him and the family to take care of his father at home. Now, you know, we thought, what if we could leverage technology and bring the care that he needs directly into the home? And so we sit at the intersection of two trends in the healthcare space and the technology space. One, it's that every day, with every passing day, we see care being delivered more and more inside the home directly. You know, it's now away from the clinic and away from the hospitals, and you know, the healthcare system is meeting the patients at home in their natural habitat where they can feel comfortable and they can feel at ease. So that's trend number one. And the second is, in the past 2 years, we've seen this explosion of voice-based experiences. Fitting technology into the routine of your daily life rather than interrupting it with another screen. So coupling those two trends together, we have created Pillow, a healthcare companion in the home, empowering individuals and patients to take charge of their health and the management of their chronic illnesses. So in Pillow, you'll find a friend, but beyond that, you know, Pillow stores and dispenses your medications into this little cup here, confirms that you've taken your medications. And then leveraging the FaceTime with the medication piece, Pillow can actually deliver services and content directly into the home. So for example, let's say diabetes, we can deliver a care plan, a daily agenda for a patient with diabetes in terms of what to do that day. It can come in the form of instructions, videos, reminders, so on. And at the same time, we can pull data out of the home in the form of surveys. Hello, how are you feeling today? Or I noticed you started a new medication. Are you experiencing any of the following side effects? And we can also connect to other devices in the home, like a scale, a glucometer, a blood pressure cuff, that can populate our back-end database. So by being inside the home, we are privy to all kinds of data that have traditionally been impossible to gather. And with this kind of data, we can perform risk stratification directly from inside the home, which may be very useful for health insurers and providers. So armed with that data, we can trigger alerts and reports back to our partners for timely intervention, which can include remote telehealth visits, leveraging the touch screen and the camera. And then using that base platform, we can add on partner-specific experiences and content. For example, I was in the showcase room and I saw the chatbot that Harvard Pilgrim is building, telling you and explaining to you all of the benefits that you have. Now, I'm a Harvard Pilgrim member, and I would love to wake up in the morning. Pillow would dispense my allergy medication, and I could ask Pillow about the copay of my upcoming doctor's appointment. So that the capabilities of a platform like this is limitless. And as we move forward and this kind of technology becomes more powerful, I really do believe that healthcare, the majority of healthcare, will take place inside the home.
So as a physician, how do you feel the physician community will react, and how have you thought about working with the physician community and Pillow?
Yeah, that's a great question. So we're riding on a third trend, I guess, and that is the rise of telemedicine, right? It's been happening over the course of the past 5 to 10 years, and I think at this point, especially with the demanding workflow and the demanding patient volume that physicians need to see in clinic, I think telemedicine or remote patient monitoring will play an increasingly larger role in staying in touch with your patients, keeping an eye on them, and triaging between those that need to be seen in person versus having just a touch point in the home. And the space is definitely growing, and there's increasing validation year by year, month by month. There's a recent Medicare CMS regulation that just came out earlier this year that allows for reimbursement for remote patient monitoring. And we're definitely seeing some movement in this space.
Great. Well, let's meet Pillow.
Great.
In today's hectic world, it's getting increasingly difficult to remember what truly matters: the health of you and your loved ones. But now, someone can help. With his artificial intelligence, Pillow recognizes each and every member of your family and starts caring for them.
Clara, here are your cholesterol pills. I see you're running low. Shall I reorder them for you?
Thank you, Pillow. That'd be great.
Pillow is 100% secure, and his skills and functionalities will grow the more you use him, the more he gets to know you.
Here are your vitamins to go. Enjoy your training session, Liza.
Thank you, Pillow.
Since Pillow's always connected, he can answer all of your health-related questions.
Pillow, how many calories are in a celery stick?
6 calories, Clara. Celery is excellent for your health.
Great, I'll have a bunch then.
Aww. Good morning.
Pillow is simple to set up and makes the management of complex medication regimens very easy. He'll remind you, so you'll never miss a dose again.
Wait, John, it's Tuesday. Here's your blood pressure medication.
You're right. Thank you, Pillow.
And if you want, he'll notify your caretakers in case of an emergency, like when he forgot his heart medication.
Hey, Dad. I just got a message from Pillow. Everything okay?
Because, you see, Pillow's not just a member of the family. He's a true healthcare companion. And since he can sync with any wearable and wireless devices, Mark can share his combined health and wellness data through one secure, user-friendly platform where he receives fast and reliable feedback.
Goodbye, Doctor. Thank you, Pillow.
Because sometimes, all you need to stay healthy is a friendly, timely reminder. And that's exactly what Pillow will do for you.
Well, what a terrific new device. And you hear so much about things in the home, always on, communicating back and forth. Interesting last one about reminding the person to take their medication. I think research shows that half the medications that get dispensed aren't taken. They aren't taken completely or correctly. So it seems like this would be a terrific help for those in terms of medication compliance.
Right, and we started out building Pillow specifically for improving medication adherence. What we soon found is that we can actually leverage the medication management functionalities to maintain engagement with the user. Rather than simply another device in the home like Amazon Alexa or a Google Home, we actually give the patient a reason to be in front of the device every morning at 8 a.m. to get their medication. And leveraging that FaceTime, we can deliver a wide variety of other content and services using that time. So 6 months from now, I know you'll still be in front of Pillow at 8 a.m. On that day. So.
That's terrific. That's great. So we've heard from Nina and Pillow. Eric, tell us about Dynamic Care.
Thanks. So I'm Eric Gastron. I'm the CEO and co-founder of Dynamic Care Health. And I also got into healthcare from the video game industry, applying skills from the game industry and engagement and gamification to healthcare now. And I want to thank Rick and Harvard Pilgrim for having me here. They're one of our champions in the Pulse program, and they've gone above and beyond in the relationship to help us succeed. And I also want to thank CV because his team at Warner Brothers was our biggest customer at my old startup.
Together.
Oh, really?
Yeah. So I got involved in Dynamic Care, which is a platform for monitoring substance use and rewarding recovery from addiction. Partially because my dad, who's also my co-founder, is Dr. David Gastron, a national expert on addiction psychiatry, and also because I have a friend named Anna who's in recovery from an opioid addiction. And her situation got so bad a few years ago that she was completely dependent on financial support from her family, but they had lost trust in her because of all the relapses. So in order to prove to them that she was sober, she had to do urine tests in the bathroom at home with the door open and her dad standing outside. And I can only imagine how degrading that must have felt for both of them. So I realized there has to be a better way to support recovery. And I asked my dad, why is it that the treatment system seems to be failing so many people who keep relapsing and going in and out of rehab? And he said, we actually have effective, evidence-based treatments, but sometimes they're totally overlooked and no one uses them. For example, using financial incentives to reward patients for staying sober is one of the most effective and evidence-based interventions we have, and yet hardly anyone uses it. And when he told me that, a light bulb went off in my head because I realized we could totally automate that whole methodology and solve this problem that Anna and her family had. So we started the company 2 years ago. We've raised money, hired a team, built the product, launched pilots with treatment programs, insurance companies, and research partnerships. And we're now actually getting this into the hands of patients and seeing the impact that it has. So the way our platform works is we do drug testing through the app. So we mail patients testing equipment like this breathalyzer, and they get an alert in the app saying, please do a breathalyzer test in the next 60 minutes. And they do a selfie video of themselves breathing into the breathalyzer or performing a saliva test. And then as they do each test, they earn rewards. We also use GPS tracking to make sure patients are showing up to their doctor's appointments, therapy sessions, even AA meetings. And all the rewards go on a reloadable debit card, which blocks access to bars, liquor stores, and cash withdrawals. So it's a very safe way of providing funds to the patient, and we can monitor all the spending that happens. So it solves this problem within the family, where now the family can contribute to the financial rewards through Dynamic Care. And that can be in combination with the payer or the employer. And the family gets the peace of mind that the patient is only getting funds when they're sober and sticking with treatment. So there's no more degrading urine tests. The patient is in control of doing their own tests, and they get that dignity back. So we're really excited to be here and be bringing this solution to more people.
Well, I love the videotaping, so you know that it's the patient who's breathing into it and not someone else.
Yeah, and our team reviews every single video to make sure that there's no cheating, it's not someone else doing it. Yeah.
I'm thinking that should get built into the video screens of most automobiles. You might want to talk to Elon Musk about that. He's usually open to innovations. Say a word about how your video game background, we talked earlier about engagement, patient engagement.
Yeah.
So can you talk a little bit about how that's helped you design things in a way that would engage that member?
Yeah, sure. So one core principle of almost every video game is as you advance in the game, your character gets more and more powerful, can do more and more, and then if you mess up, whether it's Mario falling into the pit or getting killed by demons, you get sent backwards.
Right.
So we've taken that and adapted it to our app where as you stay consistently performing all your drug tests, showing up to all your appointments, you earn more and more rewards. You build up a streak in the app But then if you miss a substance test or you miss an appointment, you get reset back.
Nice.
So that's something I learned from the video game industry, from people like Stevie at Warner Brothers.
Yeah, that's terrific. All right, let's see more about the company.
Thanks.
Welcome to DynamicCare Rewards, the digital platform for monitoring substance abuse and rewarding recovery. The app works by tracking recovery-related tasks, like appointments and substance tests. Users start out by going through a series of onboarding screens that describe how the app works. They set their permissions and their profile picture, and then they're good to go. Let's take a breathalyzer test. Users will receive a random notification to take the test within a certain window. Using a Bluetooth connected device, they will perform the test and take a selfie video of themselves doing it. The video and results are uploaded, where they are verified for accuracy by DynamicCare staff. Users can also receive reminders to take medications, which is also verified by a video recording. Users can track their mood and cravings on a daily or weekly schedule that can be customized by their healthcare provider. Users can see and manage their schedule of appointments related to recovery. The phone's GPS tracks whether or not they have attended and if they were on time. As all of these tasks are tracked and completed in the app, the user will earn rewards that they can redeem for gift cards or money deposited on a smart debit card designed for people in recovery. As the number of tasks they complete goes up, so do the rewards. DynamicCare rewards positive behavior in recovery, while giving healthcare providers a verification and data-based way to monitor their patients and provide the best quality of care.
That's terrific.
Thank you.
Great ideas, great new company. So what's the feedback been so far from folks who have used it, both in terms of the app and also the self-administered tests?
Yeah, so we see a few big benefits. One is usually in recovery and addiction treatment, patients are used to just getting punished for doing the wrong thing. They're not used to getting rewarded for doing the right thing. So it can really improve the relationship that the patient has with addiction treatment and with their healthcare providers by turning that on its head. There's one patient who was involved in one of these studies on the methodology who said, "I used to think my drug dealer cared about me. This is really caring." So it's a really powerful methodology. Then another thing we see is by having the patients get the autonomy of doing their own substance testing, it really improves their own belief about their self-worth, and they don't have to go through the kind of undignified process of having someone watch them pee in a cup. It's also just way more convenient. We had one patient who was a beta tester, and he had a court order to get drug tested every day. And before DynamicCare, he would have to go in person to a urine testing place to get that done, but his job required him to travel doing sales. So he realized he couldn't keep his job if he had to show up every day in person to do these tests. Right. So luckily, because he was part of the DynamicCare pilot, he did his DynamicCare saliva test from his car, just parked somewhere, do the test, it takes a few minutes, and then go in and do his sales pitch. So it's been really beneficial, and we see that the healthcare providers are also benefiting from being able to know what's going on with their patients in between sessions. We had one coach who thought that her patient was showing up to all her AA meetings, and then once we started using DynamicCare to actually track it using GPS, we found out that the patient was only showing up for 5 minutes to the AA meeting and then heading out, probably just getting a piece of paper signed. So the coach was able to catch that and have a conversation with the patient.
Wow. That's great, because I would think that compliance with those kinds of treatment plans for those who are battling an addiction is a major struggle for them. They both want to get better, but they're drawn back to their drug of choice at the same time.
Yeah. So we're turning that positive reinforcement, negative reinforcement that patients get from the drug use of kind of immediate rewards for feeling good when you take the drug and feeling bad when you're going through withdrawal, turning that on its head, feeling good when you're not using the drugs from getting the rewards in DynamicCare.
So Eric, say a little bit more about where the money comes from and like what's enough? You know, is there some minimum amount that people need to be able to go after?
Great question. So we've seen in the scientific literature, there have been over 100 randomized controlled trials on this methodology, trying out different ways of doing the rewards, different amounts. And what we've seen is that you get pretty significant results when the patients are earning at least $100 per month in rewards. So that's what we recommend as kind of the baseline. And of course, it can be adjusted depending on the patient's socioeconomic status. And what we do for the source of funds is we do a combination of the payer or employer and also the family. Even the patient themselves can put up money if they want. And so one model that we're trying out now is for the payer to put up $50 per patient per month, but on a matching basis with the families. So the families also have to get engaged so that the patient is really being supported. They're getting $100 per month, and it's kind of a team effort of the family, the healthcare providers, and the payer.
That's terrific. I love that. You know, when you think about people who are doing a walk or a run for a charity, they go to their families for support. What better opportunity for support is to help someone in recovery?
You should reach out to like a GoFundMe type of, so it could be friends, family,
Yeah.
colleagues, you know.
Yeah, exactly.
Yeah.
So we're actually working on building a kind of private crowdfunding site where, you know, it's not going to be on the internet for everyone to see, but you have a link that you can send to your, you know, key supporters.
Yeah. So I'm sure a lot of people are wondering what it's like to work with your dad, and who's the boss?
I'm the boss, actually.
Oh, so I should be asking him.
Yeah. So I'm the chief executive officer. He's the chief medical officer. We're both board members. But it's been a really amazing relationship for me to get to work with my dad in this way because we have very complementary skill sets. I have an MBA, come from the video game industry, tech startup world. He's an MD, expert in addiction treatment and research and psychiatry. So we don't fight too much because we have different areas of turf, and we both bring a lot to the table that we really respect in each other for understanding how to bring together business, technology, and medicine in this way.
That's great. Yeah. So in the showcase, or when I talk to folks, certainly here or elsewhere, one of the questions I often get is, what's it like to start your own company? Like, what are the first steps you take? And because, you know, a lot of people spend their careers working for different companies in regular jobs, you know, as opposed to really starting something on your own. So, you know, what was it like to start your own company? What were the first steps you took, and what were some of the challenges to getting it off the ground? Stevie, why don't we start with you?
I can tell you what we didn't start with, which we should, which is understand taxes. You've got to understand how taxes work.
I did that too.
Right, really? We've been commiserating about just, it's a terrible, terrible thing.
Do your taxes right.
I mean, the good thing with, you know, with Healthination when I started, I was already working with a lot of the engineers and the artists that I wound up recruiting. So it was, for me, it was bring on people that I trust, and I already know how they think and I know how they work. Now, the hard part was we didn't know anything about healthcare. Okay, so one of my co-founders, Paul, who's out in the demo floor right now, he had been at Deloitte for 18 years, you know, working with all the major health systems. He knew everything about healthcare, but didn't know anything about really creative development. Right. So for us, it was a melding of the minds that took a while to figure out how we can bridge the two. Right. And because that was just weird. I mean, those are two groups of people you just don't get to collaborate typically, which is, I think, why our product's kind of unique.
Okay.
But I think that the harder parts about starting a company is actually a lot of the mechanics of it. How to set up payroll, how to get insurance for everybody. You know, so I think that that was a learning thing because I've never run a company before. Right. So that's what that was.
Well, that's a good point, because when I've met with Pulse companies, one of the things I was asked by Nick to do was run a quick little seminar on health insurance. Like, how are decisions made about what to cover? Right. Because most people know what's covered, they don't know what kind of decision making we go through to decide what to cover. Right. How about you, Aiden? What was it like to start the company? What were your first steps?
Yeah, the first step was understanding that you need to take a risk, right? But I would imagine that it's a calculated risk because you're passionate about your idea. You know, it's aligned with what you want to accomplish in life, right? in our case, it was we believe that innovation like Pillow will be able to better care for millions of people and empower them to better take care of themselves as well. So to be able to chase after that and chase after that wholeheartedly, all of us had to get comfortable with the risk profile of an early stage startup, and especially challenging for me because physicians tend to have are very risk averse, I have to say. But besides that, I echo what Sivi just said, and that is finding the right team to build the company. And so for us, it was myself and two co-founders. One is, his name is Emanuele. He's from Italy and loves design and product development and has a background in that. So he led. He is the reason that Pillow looks the way that Pillow does now. And then my other co-founder is James, who comes with a background in finance and business development. So he did all of our taxes. And,
right. You got lucky with that one.
I think we did it right. I hope. But
the IRS is watching.
So complementary expertise and finding that was difficult, but when you get it right, it makes a huge difference.
Right.
He says he's not a risk taker, but he's with 2 startups right now. So it's like, whatever. You're a risk taker, Aiden, and you're a good one too. You make good calculated risks.
Well, normally, I think patients probably prefer docs to be a little risk averse, right? As opposed to, if my physician said, "Hey, let's try this wild thing," I
just heard about this thing.
That exam room.
Exactly.
How about you, Eric? What was it like to get this started?
Yeah, I spent 3 years part-time looking for my next startup idea. I knew I wanted to found something because, like Sive, I had the experience of working at an early stage startup, and I loved that, and I knew I wanted to do that. But I didn't want to start something until I had an idea I was really passionate about and really believed in and committed to. So I went through about a dozen different startup ideas over those 3 years, and what really convinced me about dynamic care was 2 things. One, the strength of the evidence behind our intervention. And 2, as my dad and I were working on the concept and developing it, my dad said, "Eric, come with me to an addiction conference this weekend. I'll introduce you to everyone. We'll see what people think of dynamic care." And so I said, okay. And we just talked to everyone at that conference about dynamic care, addiction experts and leaders from all over the country. And universally, people were really excited about our concept for dynamic care. They had never thought of something like that or heard of something like that. So that's when we knew we were onto something. And right after that, which was 2 years ago, we incorporated the company and decided to commit full time. So you don't want to just believe because it's your idea. You need to go out and validate the idea. And before that, there were a dozen other ideas that I tried to validate, and I realized they weren't going to work. So it takes a lot of time.
And what's it been like for you all being in the middle of the opioid crisis? It's in all the papers. Everyone's talking about it. Governor Baker has made it a priority of his administration. They were one of the first to limit first prescriptions of opioids when you're coming out of the hospital. You must get a lot of questions and thoughts about that, given where we are.
Yeah, well, addiction across drugs, alcohol, and tobacco is consistently one of America's leading causes of preventable death. But because the opioid epidemic is now at the forefront of the national conversation on political priorities, it's really bringing this issue to the fore. I mean, it's unfortunate that it's at this level. We have quadrupled the number of opioid deaths in the past 15 years. But at the same time, there's something that's changed where people are willing to talk about it openly because it's happening to so many people at the same time. And unfortunately, what it takes to get change to happen is for people to talk about the problem. Right. So luckily that's happening now, and it's benefited us a lot in that people understand immediately that this is a problem that needs to be taken seriously, that a lot of people are going through. Whereas if we had started the company 10 years ago, there might be just as many people who need our product, but not as many people who realize the need.
Right, that's great. Aidan, there's the always on in the home. You have some competition, Alexa and Echo and all kinds of folks, but some pretty big companies out there. How are you thinking about the competition and differentiating yourself from the competitors that are out there?
Yeah, so when I think about Pillow and how it's different from the voice assistants that are out there, I think of three things. One, it's the medication management functionality, being able to store and dispense medications, which plays a large role in managing your own health. Mm-hmm. And it has the added benefit of ensuring FaceTime and engagement over time, as I mentioned before. Two, it's this ability to proactively engage the user. So at certain times throughout the day, Pillow would wake up, scan the room for your face with the camera, and can automatically, spontaneously wake up and engage with you. Say, "Hi, Rick, how's your day going?" Whereas that functionality is not on the market today yet. You have to say, "Alexa, do this, do that," or right. "Okay, Google, do this, do that." And the third piece is a regulatory piece, and Pillow is designed from the ground up to be a healthcare device, mm-hmm. and to that extent, we've ensured that the back end is secure, that the platform is HIPAA compliant, and we take patient privacy and data safeguards very, very seriously. So, and currently, the consumer grade devices on the market today are not HIPAA compliant, right. Do not have those standards in place. So with those three things in mind, we believe that we have a first mover advantage in this space for a companion, voice-enabled companion in the home. Now, who's to say that there's been a lot of chatter about these giant companies getting into healthcare, and I don't think anyone knows what shape or form that will take. However, one analogy that I would like to make is when Amazon acquired Whole Foods and entered into the grocery delivery space, everyone thought that Instacart, this grocery delivery business, young business, was done and going out of business. However, 3 months later, I think in the next 3 months, Instacart grew the fastest they've ever grown in the history of the company, because other grocery chains in the United States were scared, and they realized, oh, we now need a delivery mechanism to compete with Amazon. So if Amazon Google enters into this space, I hope and I know that Pillow will see some very large partnerships. We're speaking to quite a few large partners already.
Well, that's great. We certainly are rooting for you, and you. Certainly as opposed to the consumer having, some of that approval, as what you've got, it puts you a leg up than the others. And CV, a crowded space, yeah. Behavior change, weight loss, that kind of thing, that Healthination is in. What do you think will most allow you to stand out from the crowd?
Yeah, I think there's a couple of ways to look at that one. So it is the most crowded space, probably, from a digital health perspective. Yeah. There are many, mostly in the prevention space. Yeah. There's not a lot that are in the treatment space. So there's one differentiator right there. Science is a big thing because we are working with the Jocelyn, and they are the diabetes leaders, right? So we know there's 15 years that say our stuff will work if we can get people to do that. Excuse me. I think ultimately what is going to happen with this, and this isn't just in the diabetes space, we're going to move into maternal health, we're going to work with kids, we want to do a whole bunch of things. Ultimately, it's going to come back to how do you get the eyeballs in there, yeah. Right? Yeah. And there's ways to do it. I mean, I love the monetary incentive model is wonderful to get people into there, right? The ease of use that you have is you're getting people, and then you're having a camera right there sitting on your countertop. These are great engagement techniques that make it easy for you to understand how to take care of yourself. For us, it's a creative exercise, and we invent whatever we want to invent. Excuse me. So think about if you're in the maternal health space, you know, you want to have a relationship with your unborn baby. And you need to figure out how we can create a animated experience that reflects that. So for me, it's around getting the engagement numbers up as best you can and teaching people what they need to know.
Okay.
Sorry, I got a
You
little cough.
okay there? Yeah.
Little cough. Sorry.
So Nick, in the little time we have left, just take a moment to say, what can we all in Boston do to help promote the success of these great young companies?
I think it's tough to encapsulate in necessarily like one phrase, but to me, it kind of, you know, take a look at yourself in the mirror and who can you be, what kind of value can you bring to these companies? You know, do you have one of these problems, or do you know someone that has a problem with you know, that these solutions can help solve? Because they're always looking for people that they can deploy their new technologies with, that are excited to be a part of this revolution. And I know all of these founders, they're excited to hear the feedback because they want to continuously improve their product. I mean, they're all built on strong evidence, and they all have strong evidence already with the deployments that they've currently done, but they can always continue to do that. I know that they're always fundraising. It helps grow their teams. It helps increase their impact. So, you know, if you're an angel investor or if you're a venture capitalist, they're always, you know, looking for that kind of support. And of course, if you're in a large employer or you work, you know, with Harvard Pilgrim, or you work with other organizations, you know, it'd be great, you know, ask for these technologies. There's a lot of really great technologies that are out there. The Pulse program has a much higher density than you would see really anywhere else. I mean, these are pre-Series B companies, but they are incredible. They come from so the last 2 years, we've had around 500 applicants each year, and we invite the top 60 in for matchmaking, and 30 or so get into the program. So these are really the top 5 to 7% of the world's digital health companies. And they're coming here to Massachusetts. And our applicant pool isn't just Massachusetts-based. We're drawing applicants from over 30 countries. So, you know, what we look for from people that want to engage is, you know, use their products, support these teams, give them feedback, you know, share the great work that they're doing, because we want to grow pillar companies here, and we want to grow pillar companies in digital health. And ultimately, if we can help them be successful, we're going to live happier and healthier lives. So I think that's something that we should all be able to get on board for.
That's terrific. Well, what a great group of companies we've heard from today, and the other companies that are out in the Harvard Pilgrim showcase. You know, when you think about some of the big companies we were just talking about, a couple guys doing a new personal computer in their garage, or someone selling books online, or competing with some company that used to be called Blockbuster, mailing DVDs to people's homes. Hopefully the next giant successful company is going to come right here from Massachusetts, from one of these Pulse companies. So from the Harvard Pilgrim Showcase, I'm Rick Weisblatt. Thanks for listening. Bye-bye.
Awesome. Nice job. Good job.